Climate change has been described as the biggest global health threat of the 21st century. There are a variety of direct and indirect ways in which climate change can and will impact human health. Health systems around the world will have to respond to these impacts. But they also have a much more proactive role to play in addressing climate change, because health sector activities are actually contributing to the climate crisis. If the global healthcare sector were a country, it would be the fifth largest emitter on the planet. From supply chains to facilities to travel, carbon emissions and other pollutants are produced in every type of care setting. This means that the very sector tasked with protecting human health is actually putting it at risk. But there are many opportunities to make healthcare more sustainable. One of the tools we can leverage to develop high-quality, low-carbon care is quality improvement.
When I think about quality improvement and the applicability to sustainable healthcare, I think about the pervasiveness of quality improvement methodology across hospitals and healthcare institutions in the US and Canada. When problems do arise in hospitals and they're related to quality outcomes, safety outcomes, timeliness of care, employee satisfaction, costs, hospitals are able to leverage tried and true methodologies that have a lot of things in common. And they are define the problem, understand the current situation, get to the root causes of the problems, and then design interventions and learn by doing. So why not apply quality improvement to sustainability and reducing the carbon footprint of teams, departments, clinics, hospitals, healthcare organizations overall, even on a provincial and national level?
What if sustainability became a mainstream part of quality improvement?
I think that's a really natural place for sustainability to sit. People are already looking at the system, what works well, what works less well, and sustainability can be built in there really naturally. In this country, the Royal College of Physicians in London has said they also believe sustainability is a characteristic of healthcare which must run through and moderate other domains of healthcare and healthcare quality. And they've explicitly said that this is not just about sustainability in terms of financial sustainability, it's in terms of the broader understanding of sustainability. I think when you take that perspective, you can kind of see sustainability as a domain or a dimension of quality, and the 6 domains of quality: safety, timeliness, effectiveness, efficiency, equity, and patient-centeredness. And then sustainability kind of fits right in there, and many times it can strengthen the others. One of the things that's very powerful about that is that once you look at sustainability as an element of quality, it should also follow that it should be part of quality improvement. So this is what brings me to the SUSQI framework that we've developed here. It changes the aim of quality improvement to bring in this broader perspective. Our goal is to maximize the sustainable value, and that means we've got to maximize the outcome, the good health outcomes for patients and populations from the use of environmental and social and financial resources and from their impacts.
Individuals, teams, and departments can mobilize QI to make sustainable changes to the coordination and delivery of care.
I'd like to tell you about how we used our local quality improvement framework in order to establish a digital faxing onboarding initiative. At the Ottawa Hospital, our digital faxing platform available is called RightFax. It's been around since 2010, but only 27 users have integrated it into their practice. We aim to increase the number of RightFax users within the Department of Surgery in order to minimize our local carbon footprint, achieve a cost savings, and improve the user experience. With the help of virtual care and IT services, we established 3 change ideas, including streamlined onboarding instructions, RightFax instructional videos, and RightFax Epic integrated workflow demonstrations. We then engaged all of the divisional quality improvement leads in order to spread the initiative across the department. From April 1st, 2020 to March 31st, 2021, 118 new users were onboarded. With the onboarding of these new users, we saved just under 140,000 pieces of paper, which translates into just under 12,000 kilograms of carbon emissions saved and a cost savings of $13,000 per paper and energy costs.
QI plans can serve as key mechanisms for embedding sustainability at the organizational level.
At every hospital in Ontario, we have quality improvement plans, and these plans have been great to move forward different initiatives that need a focus. What we decided to do at North York General Hospital is really look at our corporate strategy, which had sustainability in it, and think about how do we improve environmental sustainability as part of that. And so what we did for year one is we added a climate change agenda into our quality improvement plan, and specifically focused on carbon emissions as a priority and an area for us to improve. As part of that, the other thing we did was we made our quality improvement plan not a one-year plan, but intentionally a 3 to 5 year plan, recognizing the fact that some of these bigger initiatives are actually going to take a much longer time frame to address. Next year, we can start to focus on some of the more traditional aspects of sustainability. And that might mean we look at our supply chain, try to reduce waste, and look for things that may be outside the box and areas for innovation. It has alignment to a lot of things in the hospital, and that is our patient and family advisors have been adamant that we need to focus on sustainability. Our community is asking for this, as well as suppliers are starting to be a little more open in terms of how they work with hospitals to move this forward. The nice part is it also helps the bottom line in many instances and saves money. And then there's an element that we looked at too, where it's the right thing to do. And so it's one of these areas where I think every hospital, probably in the Western world at least, in the next 5 to 10 years, will have sustainability as part of their quality and corporate plans.
Health professionals have an obligation to do no harm. As the climate crisis looms larger, we need to use all the tools at our disposal to ensure that our practices do the least damage possible to people and the planet that sustains them. Small changes in everyday practice have a cumulative impact on the overall sustainability of the health sector. So it's time to ask ourselves,
what are some things that we can do to reduce our carbon footprint as healthcare professionals in Canada and across the world? I think there's a big opportunity in leveraging quality improvement methodologies and frameworks. So I hope you'll consider doing it, and I hope you consider getting started where you are to figure out what are some behavior changes that you can do to address and understand your current carbon footprint